In our case today, we have a patient who is not satisfied with the aesthetics of her front 4 teeth. So we went ahead and removed her existing full coverage crowns and re-prepared the teeth. After the teeth have been image scanned for their final restorations, we are now going to make our provisional. I always start by coating the preparations with a layer of petroleum jelly to make retrieving the provisionals a little bit easier after they set. We are going to load our clear PVS bite registration matrix here with our Tuff-Temp material by Pulpdent. One of the things I love about using a clear PVS bite registration matrix is that we can see through it to make sure we don't have any voids and then cure through it. After I've seated it in place, I'm going to take a cotton tip applicator and remove the excess. We're then going to let it set in the mouth, retrieve it after about 2 minutes, and then I am going to light cure that through the clear PVS matrix to get those fully set. Once we're done light curing this, about 5 to 10 seconds per tooth, I will then tease the provisionals out of the matrix, trim them with some discs and finishing burrs, and polish them. And here you can see our seated provisionals with our cord packed and a little bit of gingival recontouring. After 2 weeks, our final restorations have been created by the laboratory. The patient is going to come back in, we're going to slightly anesthetize and then remove the provisionals and clean the preparations. We tried in our crowns already, we've cleaned those and prepared them for bonding, and now we are ready to go. We are going to load our crowns with our ACTIVA Cement. I always start with tooth number 8 and then go to tooth number 9. I'm going to use a micro applicator to remove any excess and then move on to the laterals, 7 and then 10. Now, once those are in, I'm going to do a quick little tack here, maybe just a second or 2 per unit, just so that I can remove the excess cement before it fully sets in larger chunks and not quite as liquidy. I will use my scaler to do this, and we're usually able to pop off the chunks of cement in larger masses. Once I've done that, I now want to make sure that my contacts are cure, and I'm going to pass floss through once or twice on these, pulling it through the side, just to make sure that we get all the cement out of those interproximal areas. Once that's all done, it is now time for our final curing, and that's what you see going on here. I'm going to cure that for 5 to 10 seconds per crown, hopefully from the buccal and the lingual both sides. That's going to get us a nice full set. You can see our pre-op presentation here, and then our post-op after our 4 anterior ceramic crowns done on teeth 7 through 10. Thank you so much to Pulpdent, for ACTIVA, and for Tuff-Temp for making this case possible.